All right, let's take a look at our arteries here. Now remember, when we compare arteries and veins, that by definition an artery is a blood vessel that takes blood away from the heart into the tissues, and veins are exactly the opposite. They take blood away from the tissues and back towards the heart. So the direction of the blood flow is the really big difference. We're going to look at several other differences between most all arteries and veins a little bit further along. But think arteries away from the heart and veins back towards the heart. If you want to think of that as towards the tissues or away from the tissue, same way right there. We're going to look at our arteries, a little continuation of some of the major ones here in just a second. But once you go through these arteries, eventually you're going to hit what's called an arteriole. That's the smallest of all your arteries. The last artery that still has the tunics, the layers in the wall, before you get to a capillary. And when we get to capillaries and look at a discussion on those, you're going to see that capillaries are the thinnest and smallest of all your blood vessels. And when I say thin, I'm talking about their wall. When you get down to a capillary, you no longer have the tunics or layers that you see in these other blood vessels. All that capillaries have is an epithelial layer called the endothelium. Now that's an inner epithelial layer that lines all your blood vessels. But once you get to a capillary, that's all that's left. And what that endothelium is a simple squamous cell layer. Simple squamous means one flat. That is as thin as it gets in the human body. So since there's such a very thin layer between your blood that's inside that capillary and then whatever tissue is around it, that's why practically everything moves in and out of your blood at the capillaries. That's where the wall is thinnest. Now after a capillary, we're going to go through veins. The first one you'll see are venules. That's the smallest and tiniest of all your veins. But again, they're going to be taking blood and material away from the tissues back towards the heart. We'll also see that arteries have much thicker walls than veins. Well, arteries are back closer to the pump, right? Thinking about the two pumps in the heart. Well, the left ventricle is your primary pump that pushes blood to just about everything from the top of your head to the tip of your toes. So when you look at things like that aorta and these other arteries which are close to the heart, they are under very, very high pressure. So since arteries are under higher pressure than what veins are, they need a much thicker wall. In other words, they're tear and rupture. And that's what can happen as we get older. And you've probably heard of aneurysms before, but that's something we'll look at further down the line. But once you move out of the, say, the left ventricle, you're going to get into what's called these large conducting arteries, also called elastic arteries. Called that because they have a very large amount of elastic tissue in the wall. You figure every time that left ventricle shoves blood into one of these arteries, it stretches and expands. When that ventricle relaxes, well, that artery wall recoils, right? So like when you blow up a balloon, if you let some of that air pressure out, the wall comes back closer together. It's what we mean by the recoil. And that's what you're feeling when you feel a pulse. If you go to something like this radial pulse, you're not feeling the blood going through that artery or anything such as that. You're feeling that wall expand when the pressure rises. That happens when the ventricle pushes blood into that artery. And then when the ventricle relaxes, that artery wall recoils. So think about that. Every time blood is shoved into that artery, that wall expands. That's what you're feeling, is the expansion of that wall when you feel a pulse. There's no doubt there's elastic tissue in arteries. But again, back closer towards the heart where you see bigger pressure changes, you have more of it. It also helps to stabilize your blood pressure by letting those artery walls expand. If they didn't, blood pressure would have to be a lot higher than what it is, and of course that's not a good thing. That puts a lot of extra workload on the heart. But once you leave the heart and you lose, or I shouldn't say lose, but you get away from these very large arteries which are very close to it, then you start to move into what's called the distributing or muscular arteries. So there's a lot of smooth muscle in the wall of these arteries. And this is largely where you see a lot of that vasoconstriction and dilation when your body wants to divert blood flow. Something in your body gets more active, gets more blood. Something's less active, it's going to get less. So this is where a lot of it happens. Not entirely, but a big part right there. But let's also look at these three tunics, these layers in the wall of a blood vessel. Now we've got pictures in the lab book. We're going to see all this stuff. It's just a little overview before we get to the book itself. So when you look at the layers, remember that's what tunic means. We've looked at layers of other things like the heart wall or whatever. Now we're looking at the layers in a blood vessel wall. So the very outer superficial layer is the tunica adventitia. Sometimes that's called the tunica externa because it's external on the outside. It's a tough, dense, collagenous connective tissue layer. It's like a tough skin on the outside of that blood vessel. That's a good thing to have. Then you get in that middle layer, that tunica media. Here's where most of that smooth muscle is found. Again, the smooth muscle in the walls of blood vessels can constrict or dilate. If it constricts, well, less blood goes to something. If it dilates and relaxes and opens up, more blood goes to something. Just another thing that sympathetic division of the nervous system has control over, going back to that medulla oblongata. And then the very inner layer on the inside is the tunica intima. So this is the very inner layer that the blood actually comes in contact with. There's a little connective tissue, but primarily what's there is that endothelium, that simple squamous epithelial layer. Again, you get down to a capillary, that's all that's left. But as you can see, there are tunics, layers in the walls of pretty much all your other blood vessels. Another good question to ask right here is that when we look at valves, and you may have already seen some in the heart, but you'll see them in some of your blood vessels. Veins will have valves in them, but arteries don't, especially the valves which are lower down towards your lower limbs and feet and so on down the line. When you get in veins which have diameters greater than like a couple of millimeters, and as they get down closer towards your feet, it's a little bit more difficult to get the blood flow back up from those veins towards the right side of your heart. So veins need valves in them because of their low pressure, and when you get down towards your feet, when you're vertical, you got gravity working against you, veins definitely need them. Arteries never do. Arteries are under very high pressure. You would be dead long before you ever had to worry about backflow in any artery. So veins definitely need them for a few reasons, the arteries don't. But let's look here also at a little comparison between arteries and veins. Now remember, by definition, number one thing determines artery from vein is the direction of the blood flow. If you want to say arteries take blood away from the heart into the tissues, good way of looking at it. Veins do the opposite, away from the tissues and back towards the heart. Look at some other differences here. Arteries tend to be high in oxygen, where veins tend to be low in it. The pulmonary arteries and veins are an exception to that gas rule. Arteries, most of them tend to be low in carbon dioxide, where veins tend to be high in carbon dioxide. But again, the pulmonary arteries and veins are exception to this rule. In other words, the pulmonary veins are like you see over here on the left, and the pulmonary arteries are like you see over here on the right. But all your other arteries will be high in oxygen, low in carbon dioxide. All other besides pulmonary veins will be low in oxygen and high in CO2. We already mentioned before, arteries need very thick walls. They're under a much higher pressure, so you need that thicker wall to keep that blood to the inside and, of course, keep that wall from rupturing. Veins with their much lower pressure have much thinner walls. So there again, you see arteries are under higher pressure, veins lower pressure. We said before, arteries don't need valves. Many veins do. The ones above your heart, again, gravity works to return blood flow to the right side from them, so you're not going to see them there. But again, the larger veins, closer down you get towards your feet, you see more and more of them. And also, your body likes to keep arteries deep, but a lot of your veins come superficial. So any blood vessel you can see right below your skin, that's always going to be a vein. Because the arteries are under high pressure, you better keep them deep and protect them more, because you ever cut an artery under that higher pressure, you can lose a lot of blood real quick. So that's the body's way of helping to protect them by keeping them deeper. But let's look at this transition, this changing of arteries and veins as you go away from the heart and then back towards it. So when we leave the heart, and specifically leaving that left pump, that left ventricle, you first see the very large elastic arteries. Remember when they say large here, they're talking about in diameter. It has nothing to do with the length. Arteries start off very large in diameter and get smaller as you go away from the heart, and veins are just the opposite. So again, you start with the very large elastic arteries. Think of things like that aorta and those very big arteries attached to it. Then eventually you run into these medium-sized muscular arteries. A lot of smooth muscle in the walls of those. Then eventually you're going to hit an arteriole. Last arteries before a capillary. Again, capillaries just have that simple squamous, one flat layer that separates the blood from whatever tissues around them. So again, here's where practically everything goes in and out of your blood. You leave a capillary, you're going to go into the first of your veins, the venules. So again, they start off very small in diameter, and they're going to get larger on the way back. So then you just run in after venules, what they call small veins, medium veins, large veins, right on back towards the right side of your heart. So here's a lot of the major arteries we're going to look at. We got pictures for all these in our lab book right here. And here's some good little questions to ask yourself too. End of the lab book always has some good questions, and here's some others you can add to it. So we'll continue with our lab book next time.